We have two guests this evening. We have Dr. Kim Dodge. She is a vet. She's a veterinarian. She graduated from Michigan State University in 1999. She did her undergraduate studies also at Michigan State University. She is the founder and board member of, I want to make sure I get it right, the Association of Medical Professionals with Hearing Loss. Secondly, a local resident, Dr. Jenny Miller. She's an RIT alum, yay. Go Tigers. Dr. Miller graduated from RIT in 1906. She was a soccer player for RIT. And she is a gold medalist for Deaf Olympics 2010 in Australia. 05? Oh, I'm sorry, it was 2005. I thought it was 06, but it's 2005. She was an Olympic medalist. Yeah. She graduated from veterinary school in 2010, and currently she lives in Macedon. In farm country, she has 3 children, and her husband, who is here this evening with us. And her proud parents, Dr. Buckley and his wife, Judy, are also in the audience. Ladies, thank you. Thank you for being here.
Well, I'll tell you a little bit about who I am and my background and training, and then we'll each talk a little bit about what our daily experiences are like. Both of my parents are deaf, and I tell people that I really came to deafness the easy way. You see, I was born hearing, and I learned ASL from my parents on a native basis. And then when I went to kindergarten, I failed a hearing test, which surprised my parents. But they'd, okay, we'll keep an eye on things here, but slowly my hearing degraded over time. I had already had language at home, though. I could communicate with my parents. So for me, I didn't notice anything different. I don't remember any particular point in losing my hearing. It was just my life. I thought that everyone grew up to be deaf like their parents. You grow up to look like your parents. You're short like your parents. And I grew up to be deaf like my parents. It seemed like, okay, that's just what happens in life. But at that time, no one knew if I would be deaf or become more profoundly deaf. And the school options in my area were limited. There was the Michigan School for the Deaf, which was 3 hours from our home. There was a local speech reading oral training school near my home, and then there was a mainstreaming option. And my dad was a deaf VR counselor who used sign language in an area that had predominantly people who were deaf who were orally trained. The school made it pretty clear that that wasn't going to be an option for me to go to school there, and my parents agreed that it probably wasn't the best place for me. So really the 2 options left were to be far from home at the School for the Deaf or to be in my local mainstreamed program. So I come from a very small community. It's kind of a rural area. There weren't a lot of people, and everyone there seemed to know me, so I thought there'd be a lot of assistance and support, and it was exactly that. I was doing well. My parents were happy with the school environment. And then one day I came home and I said to my mother, I want to be a veterinarian. I'd seen in my father's family several doctors, traditional doctors, and I thought, well, people are gross. I don't want to touch people. That's gross. That doesn't work for me. No thanks. I can't touch people. But I like animals, and so I'll stay in the medical field, but I'll just work with animals. Keep in mind, when I was 3, I was bit by a dog. When I was 4, I was bit again. I really needed to change my behavior. Apparently, I didn't learn from my lessons. And my mom says to me, really? You want to be a vet? Okay, we can do that. You can do that. So when I got into college, I called myself an ADA baby because my first year of college was the first year that the ADA was passed. It was 91, 92 time frame. And there was more accessibility at the time, and I was learning how to use interpreters and working through all of that. And I learned quickly when I took my technical classes in college. Most interpreters are not trained in that environment. They're more typically trained in the liberal arts types of settings, everyday language. And when you come to gamma, alpha, molecular chemistry, and biology, the interpreters were lost. They really struggled with keeping up with the information. MSU had a program that was wonderful and very helpful for me. It was called Vet Word Bound. And it was a program that the veterinary counseling services provided. And it was a group of women who never said no to me. Not once did they say no. They were as supportive as could be. If they needed interpreters, they found them. If they needed funding to pay for access services, they found it. They were extremely supportive. They had a wonderful can-do attitude, and it was an amazing program for me. I feel very fortunate to have gone through that program. Through that program, I got to know a lot of the faculty at the MSU vet school, and so when I was ready to apply for veterinary school, I knew who the various people were. They were familiar with me a little bit. I think that helped quite a bit. Helped me in my application process. I was very fortunate. I got into the veterinary program, and that's when really the challenges and my problems with access services began. I had interpreters from my undergraduate coursework follow me into graduate school, and the vocabulary was difficult, but more difficult than that was the speed at which the information was just dumped, and the interpreters had a difficult time following up and keeping up with the information. They didn't want to have the extra task of learning the information outside of the classroom, and despite my struggles and trying to go back and forth and negotiate with the interpreters, I ended up having to fire them because it wasn't working out. And instead I got CART services. Captioning services was an interesting experience for me because with the interpreters, you see, other students and faculty would look at the interpreters and think, oh, that's so cute, you're doing a great job, even though they had no way of assessing what kind of job the interpreter was doing. It just looked good to them and it was pretty and they thought everything was wonderful. But with captioning CART services, I could ask my hearing peers to read the information and tell me if there were any discrepancies with what I got through the CART services, and there were just as many mistakes with captioning services as there were with interpreting services. Information was missing, but at the time it was better than nothing. So what it meant for me is when I completed my coursework and I began my clinical work in school, CART services weren't really going to work out. I can't imagine a CART operator coming onto a farm in a field with manure and cows and animals and all that goes on in a clinical setting, and so I knew that wouldn't work out. So I made the decision to go without access services for the last year and a half of my program. So I had no accommodation, no interpreters, no CART services, nothing at all, and it was really challenging, specifically to learn surgery without any communication. I would write back and forth, and at the time, I was very lucky because it was when we first began using paper drapes over a surgical site. And so I utilized markers. I was famous for bringing my small whiteboard with me wherever I went. And I was lucky that my classmates were very supportive and they would write information on the whiteboard for me. I think several of them still have carpal tunnel because of that experience of all that they had to write. And they were wonderful. I took advantage of all their helpfulness. But for my first surgery ever, I'm standing there and we've got a paper drape over the animal and there's an opening where the surgical site will be. And all around the opening for where this incision site is on the paper drape is writing in this circular motion. And I would just look and follow the writing of my instructor and my peers and figure out what next step I had to do. And it was an amazing storyboard of a surgery, A to Z. And I made a few mistakes and we all got through it, and that was the experience of it all. Again, I got through it, my clinical work, I graduated, and I was so fortunate because upon graduation, I didn't have a difficult time getting a job. Everyone was open to the idea of a deaf veterinarian, and really, what I needed as an accommodation, the only accommodation I needed, was to work through the phones. Some of you may not remember long ago utilizing TTYs and TRS or text relay service. It was great at the time, but the communication was slow, and the communication between the two people had to be typed, and it was cumbersome and slow. And I was an on-call provider, so I had my pager, which meant that I was tethered to my home all the time. My TTY was at home, so I couldn't go anywhere else because if I left the house, I wouldn't have access, and no one else had TTYs around me, so I stayed home. Surprisingly, most of the clients I worked with were totally okay with it. And, they would explain what they needed to, tell me about the client. Of all the things they could have complained about, they never complained about having to use the relay service to communicate with me. It was amazing. There have been some really nice changes. Now we've got the video relay service and everything is free and it's accessible, and I've got mobile access. I can have my phone in the treatment area. I can place a call to anyone from anywhere. And communicating with clients is so different. Back in the days of the TTY, I was reading an output of the text of their conversation, but I had no idea about how they felt. Were they angry? Were they upset? What were they feeling at the time? But now with video relay services, I can see the interpretation of the client's comments. I can catch things a little bit earlier. I can deal with it. I can negotiate the conversation so much better. And it makes my job so much easier as a result. And I've got my cell phone. I can text someone. If they need to reach me, they can simply text me. I can have my phone anywhere in the area where I work, and all of the conversations can happen via text. So it's been an amazing thing to see those changes happen. They've all been great changes, and they make life easier. Honestly, the worst part about my experiences are not being deaf, it's being short. If you can imagine doing surgery on a cow, cows are big. The back end of the cow, where their back is about as tall as I am. And cows don't lay down for surgery, they stand for surgery. So there I am, right? Sometimes, you may not know this, but cows have 4 stomachs. And they have an occasion for one of their stomachs to sort of swing from side to side, and occasionally it gets a little bit hung up in there. And the procedure to fix that is to do a surgical incision on the side, pull that stomach down, stitch it into place, and hold it still. But I'm short, and I'm reaching into a big cow, trying to reach to the opposite end of the cow, and my arm isn't long enough. I've had instructors pull me out saying, "You can't do that, you can't touch the cow." And I say, "But I have to touch the cow, my arm's only so long, and I've got to get to the other end of the cow to get the stomach." And they pull me out and say, "You can't do that, it's not nice, you can't touch the cow that way. You can't put your head on the cow." I say, "Well, I can't get in the cow without putting my head on the cow because my arm's too short." And there I am trying to reach in the cow, and my head's bonking against the side of the cow's body. Poor cow, I think the cow must be wondering, what is happening back there? So really, the worst part of doing my veterinary procedures is working on large animals, being a very short, petite person.
My name is Jennifer Miller. I work in general practice nearby the farming community, Waldworth. You've heard of that, near my hometown. I was born in Kansas, but shortly after that moved here to Rochester area where my parents started working in the community. And I went to school mainstream all the way. Started knowing I was hard of hearing young, age 2 or under, I think. Started with hearing aids, going through. Parents were strong advocates in the school district, making sure that I got what I needed, even if I didn't want it. FM systems, who remembers FM systems? Yeah, I broke those. On purpose. Wasn't a very good child with those. But in my hearing, similar, we had a small school district. We knew the teachers, they were very supportive of making sure that I would succeed, even though I was deaf or hard of hearing at that time. Over the years, my hearing went down more and more, and hearing aids were less helpful for me. So in the middle of vet school, I decided to go ahead and get a cochlear implant. And that was a big transition. I hated it at first. My dad was like, "Oh, calm down, be fine. Oh, it won't work." But happy, did that. I grew up with a deaf father, hearing mother, the whole family side. Very comfortable upbringing. Really, I struggled mostly with just social, with hearing kids all the time. You know, it was a little bit hard, feeling a little bit isolated. Luckily, I played a lot of sports. And if you play a lot of sports in school, you tend to have more contact because they want you on their team. Actually, you know, if you're lucky, you have a few friends that learn sign language. My best friend from 4th grade learned sign language, and now an interpreter, Kate. She loves attention. Anyway, so I grew up in that school district, graduated high school. I already told my parents at age 7 I wanted to become a vet. And my mother went, that's hard. You know, it's a lot of struggles. Are you sure? Are you sure? Yes, 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 yes. My father's like, oh, sure, sure, she will. Whatever. Then I arrived at undergrad, biology major. Decided to go ahead with that, RIT. And use the support services here at NTID a lot. I used the note takers, a little bit of captures. It wasn't that popular at that time yet, and interpreters all the way. When I was here at NTID, I loved it. I didn't have to fight to understand so much. I could just sit and watch. I didn't have to like think what they say. It was a lot easier at NTID support. I also used the tutoring in the College of Science. Back then it was in the basement, in a little office. It still is. Oh, how nice for you. But I feel like at the time I lived there, but using those services with tutors that could sign was very helpful for me because chemistry and I did not get along. And it was a challenge for me to learn how to study. So teaching me how to do that so I could survive vet school was very important. And in NTID, RIT, you know, I still plan to become a vet. You know, I worked here as an RA in the dorms, and I played soccer, and I was busy, going back and forth. I had a sweetheart, you know, running all around, and then I said, oh, I'm still gonna go ahead and be a vet. And then my father took me to Jay's Diner and said, it's great you want to become a vet, great, but when you sit down and have a serious discussion, what's your plan B? I said, I don't have one, I'm going to be a vet. Graduated RIT and went directly to MSU, and in between got married that summer. And I think it was, 8-9 days later, we started orientation at MSU. And loved the school, but different than RIT. I thought quarter mile was a long walk until I got to a big campus. They walk, it was 2 miles, campus, class, crazy. But, you know, love vet school, very challenging, long hours. Just undergrad was so easy compared to vet school challenges. For services, I arrived, and luckily they already knew Dr. Dodge. They loved her, they thought she was amazing, she was an angel, so smart, blah, 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 blah. It was great, but I was a little nervous following her footsteps after that. When I arrived, I had interpreters. One was good, the other one not good. And so I struggled a little bit. Try to be a nice person, but it didn't work the day she arrived and said, oh, we will go to class and learn about horses. She meant horses. I'm like, okay, well, you need to know basic animal science to keep up with me, okay. So we switched interpreters about, I think it was 6 or 7 times, because understand, Michigan, that area does not have strong interpreters with technical skills. So they were hiring new people who just learned sign language, not even terminology. Luckily, we found one young woman that caught up, and for the next 3 years, I had 2 interpreters. I called them my secret service, because through classes, through clinics, they were with me all the time, all the time. If I was on call and I got called in 2 in the morning for a surgery, my interpreter was on call and got called in 2 in the morning for surgery. She would come with me. So for me, it was less writing, more with my interpreter. Luckily, also, I had support from the students there, and a few of them learned sign. There are pictures of me with signing surgery with the student across from me going, 1 suture or 2 size, which? And trying to figure it out. Really lucky, those hearing students wanted me to feel involved. Really, when you get into vet school, you do anything to survive. Same with me. My deafness was not the biggest challenge for me. Really, the biggest challenge was just surviving the hours and the work and trying to memorize and taking tests and having no sleep and, you know, being married, and it was just busy, busy, busy. So I used captioning a little bit for classwork. It was easier to give my interpreters a break so they would survive until I graduated, because it was pretty exhausting for them. And in clinics, it's funny, my interpreter said after I graduated they couldn't go back to work for the rest of the college. Why? Because it was regular classes. Engineering, liberal arts, math wasn't fun anymore. They liked seeing the animals and the blood and the poop, and they got used to that. So, graduated from MSU and went directly to work. You have the option of going and learning more, becoming board certified, going to specialty programs. I decided to go ahead with large animal work. Couldn't see jobs in this area, large animal. The economy, so there were no cows and horses, were enough for me. So I decided to go ahead with small animal, and didn't have a hard time finding a job because of my deafness, mostly because of the economy. Still found work, just not what I preferred. And then recently, in the last 1.5 years, I've transferred to a clinic that's near my home. And it's a private, family-based clinic. I love it. It's wonderful. They have lots of expensive toys for me to play with, and great clients. I really enjoy my work there. It's the community that I grew up in, so it's nice. But in work, I use caption call for phones with clients. Most of the time, they don't know that I'm deaf when I call them. When they meet me in person, they know I'm deaf. I tell them, you have to look at me or I don't understand anything, sorry. It's still a challenge when I have, a beard or accent or missing teeth. That happens a lot too. It's a challenge for me to understand what they're saying. I have no shame or fear of saying, I'm sorry, I don't understand you. Try again. Oh, we don't understand? Right. Or I'll call my tech to come in. It's funny, one of my technicians used to work for her in another hospital. So I arrived, she's like, oh, you're deaf. I love Kim. She's an angel. She's wonderful. She knows everything. I'm like, yeah, I know. I get it now. So, my technicians and my bosses, they're wonderful support staff. And in the surgery, I'm very focused. If they need my attention, they know flick the light, stay off the ground. They know how to work with me. I taught them all to stop signing 3. That's the first adjustment. So, for a farming community-based practice, that's a big adjustment. So I'm a general practitioner. Means what? Like you're a doctor, I'm there during office hours during the day. I come in the morning, I do surgery, see appointments. Sometimes it's simple, like a shot. Simple, 15 minutes, how are you doing? Any problems? No? Great. Boom. That would be boring if it was only that. Luckily, it's not. I also see if they break a leg. If they're old and they have many, many problems, I'm trying to figure out, which problem I need to solve first, how to deal with failing kidney, liver, blind, how to deal with if the animal has a problem and the owners have no money. I can't do everything for free. I can't afford that. So trying creative solutions to help that animal. Okay. Sometimes my appointments will start and the day will be going click, 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 and then boom, and it'll happen. An animal arrives and it's hurt and I can't fix it. So what do? You have to put it to sleep. Okay. And that's challenging. That's challenging a job where my next appointment might be a new puppy, and I have to, start over again. Not let it affect my work. That's challenging for me. We love the animals we work with. At least me, I see my patients. I see over and over and over again. Some of my patients are now from puppy, and they're now 5. So it's cool to see them develop. Okay. During, my day doing surgeries, we do routine surgeries, spay, neuter, that kind of thing. If they eat a sock, if they eat a ball, raw, shoes, underwear, that's a popular one too, underwear, they eat that. Do surgeries to remove that. But generally, when the time ends in my day, I'm supposed to go home. You can ask my husband, it doesn't normally happen. But when the clock ends in my day, normally, appointment's finished, I finish paperwork and I go home. Sometimes, most of the time, I have something sick, I have to stay a little bit longer, or clients to have problems, or they need to talk or have an issue, they need to feel better, more secure in what we decided that day. I have to call and with them. That can be challenging sometimes. But if I have an animal that arrives, I look at it, I said, I can try, but I feel not safe leaving it in my hospital overnight. It's not safe. No one's there to watch it. What do? I send it to her. That's her job. Or if I'm in the middle of appointments in the day, it's crazy. I have appointments. I have 20 people waiting to show up all day, and then a car, boom, hits a dog and arrives in my clinic. What can I do? Stop all day, try to save that dog, fix that problem, or I send it to her. I move on with my schedule. Sometimes that happens. It depends. But I'm general practice, meaning more everyday routine things. If I think it might die, I tend to call her. Send it her way.
I don't like getting up in the morning. Emergency medicine, 95% of my job is late afternoon and through the night. I'm not a morning person. I remember saying to my parents, I'm going to get a job where I don't have to get up in the morning. And they said, sure you will. You got to have a day job. That's how it goes. And I said, nope, no, I don't. And I don't. I don't have to get up in the morning with my current job. It's great. I like emergency because I have a pretty short attention span, actually a really short attention span. And I don't like those little minor procedural fixes that are just the same old, same old. I want blood and guts. I want drama. I want gore. I want to be in the thick of what's happening right now. I don't want to have to wait 2 or 3 days to see if things get better. And really the busiest part of my day is like that 4 to 6 o'clock sort of time frame, because a couple things are happening traditionally at those hours. Other veterinary offices are closing, so those are the hours that their days are ending. I'm getting all of those calls, and I have to call them back and figure out what animals they're referring to me. Some animals that they don't feel safe are overnight without being watched. Other cases are very complex and they need to be stabilized. Sometimes there are surgical procedures that are needed. And so we've got emergency care services and then kind of the stabilization care services. And I'm dealing with animals, again, that need to be stabilized, and then they're referred back to the vet's office or dealt with in the morning. So all of those calls are coming in. Again, offices are closing. That's when my day heats up. And so probably the busiest hour of my life is when I've got the emergency cases, where I've got animals being hit by cars, or I've got an animal with a blood clot around its heart and the heart can't function. There's pressure on it and it has to be aspirated quickly or the animal will die. Or you've got a cat whose kidneys aren't functioning and they need to be catheterized because they can't urinate. Or I've got an animal brought in from another veterinary office and they've got kidney failure and they need some help, emergency services. Or an animal that's eaten something toxic like chocolate or whatnot, and they need emergency services. All of those phone calls are coming in. And I work with interns, so I've got to train them. Typically in a program, your first year out of veterinary school, you choose an internship rotation that will be in the field of your choice. So interns work with me for 1 year. They get emergency veterinary services in my offices, so they understand emergency medicine. And they'll see a case, they learn how to debrief about it. We'll talk about the plan of action that we're going to take with the animal. We'll check in with one another. There are many opportunities for me to instruct them in procedures. For example, it's a pretty large needle that we have to use to aspirate fluid from around a heart. So I have to instruct interns about being very careful. It's one of my favorite procedures, by the way. I love that procedure. Interns kind of freak out, but I love big needles. And so it's kind of my niche, and it's a practice and procedure that I really enjoy. But there are many teachable moments for the interns who work with me. Sometimes they'll have to do surgery with me if it's very busy. More often than not, I'm doing less and less of my own surgery just because it gets too busy. So in that case, I'll call in a surgeon who'll do the surgery for us. If I have time and I feel like I can, I really do enjoy doing my own surgical procedures though. And that can be a little bit sticky because sometimes I've got a variety of staff who don't work with me on a regular basis, and so they're not quite used to me in a surgical room and they don't know how to communicate with me. They learn quickly. They have no choice. There we are. You can't quit in the middle of surgery. So it's not that bad, right? Nobody's left the room crying, and maybe they have, but I don't know about it, and it's their problem if they have. It's important that I'm alive and the animals make it through, and we do what we have to do. So it's a busy, busy night overnight. My night goes fast, and in the morning I've got rounds I'm conferring with other doctors. I'm debriefing them on what's happened through the night with the variety of cases that we have. Some are being transferred for other procedures at other veterinary offices, or they're going back to their regular vet. The interns will come in for the daytime, working with the daytime doctors. And then once all of that debriefing is done, I get to go home, and I'm never ever bored, and my time goes very quickly while I'm in the office overnight.
So we're trying to decide what we wanted to talk a little bit about. In general, the public doesn't understand about vet medicine, especially with death. One thing that's always interesting to me is that people say, oh, you're deaf, it must be hard to be a vet. It must be hard. Like, well, sometimes yes, sometimes, but I try to find the positive that is beneficial for me because I'm deaf. I have a positive for it. An example would be that oftentimes I'm communicating with clients that are not happy people. Either they're not happy because their animal's sick and they're concerned, they're worried about it, or they're not happy because they're generally not happy. That happens too, but you have to be able to communicate with them. Sometimes doctors are not that great at eye contact and noticing behavior and body language change. So when I'm speaking with the person, I have to look at them. I don't understand if I don't look at them. So for me to be able to catch their body language, they're starting to get frustrated, they're starting to get upset, or they're starting to cry, I catch it a little bit earlier sometimes than my peers because I'm already looking at them. I'm not looking at a computer or paper or something else. So communication, being able to right away focus on communication, keeping your body open and facing a person is something that they have to train hearing people to do. They actually take a class on it in vet school, how to use your body language appropriately with other people. They do. They video cam and then they give you criticism saying, you didn't do that right, you didn't look at them long enough, you didn't seem serious. All right. For a deaf person, we're already there, we're already looking, we're already, seeing change of expression. We're trying to, we just want to communicate. I don't care how we communicate, I just want to communicate clearly. Okay. The other thing that's positive is I used to do large animal medicine interests. And when you're deaf, you're looking. See your peripheral vision, always open. Saved my neck a few times, all right? When an animal moves suddenly, and I was already aware, I was already paying attention that that animal was moving suddenly maybe. Sometimes hearing people focus a little bit more on what they can hear and not focusing on their eye strengths, okay? So same with animals. If I see an animal that's sitting and they seem okay, but to anyone else they're saying they seem okay, but I see their body language getting stiff. I see their lip getting, I know not to kiss that animal. Okay, no. All right. So being deafness and aware sooner, it's nice. It's a nice skill to have to start with. I didn't have to learn how to look at people. I mean, you wouldn't think it'd be that hard, but apparently it is. They have to teach it. All right. And being deaf too, positive is when I went into vet school, obviously they already loved Dr. Dodge. They loved her. But one of the problems with, for good reason, but one of the problems of getting into vet school is that there's so many people that want to go at the same time, and there's not many schools. Right now, I believe there's 31 schools in the United States. So it's hard to get in. And when you get in and you do an interview, it's hard to look and sound and be different. You see interview all day, it doesn't seem different. If you're going in and you're deaf, they remember you. So it's positive for me to be able to meet people and say, yes, I'm deaf, but so we talk, we work it out, we find a way to communicate. Me being deaf is not my biggest challenge in life. It's not my biggest challenge at all. For most it benefits me. And I like being able to turn it off when I want to. I'm the only vet that can work with in the middle of the loud, wow, 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 animals, making noise. I just off and finish typing my notes and focus. So there's some benefits.
In the treatment area, it's a large room, not as large as this room, but it's a very large room, and all of the animals are in their crates around the perimeter of the room. and it's constant barking. And I look at my peers who have to listen to it all day, and I'm blissfully unaware of it. My world is peaceful and quiet. I can do my work and get it done. None of it bothers me. I can take care of phone calls and get it done. It's so much more quiet and peaceful for me to do my work, even in that loud environment. It's interesting, one thing, when I was in veterinary school, I'm profoundly deaf. I can't hear a thing. I have no residual hearing. And to learn how to listen to heart sounds for an animal was a skill. I had to teach myself to do it with my hands. And like Jenny said, I really use my eyes a lot in my practice. And I had to learn how to watch the respiration rate of the animal. And I try to teach that to interns. They desperately want to get close to the animal and listen to the heart sounds, and they're trying so hard to listen for 10 minutes at a time. And I think, this animal's going to die in the time that you're just trying to get heart sounds. You need to get on it and do the emergency services. I understand their need to want to listen, but I can recognize from watching an animal's respiration rate. 50% of the time I know what's wrong with a cat or a dog just by watching their breathing and watching it and using my eyes and watching carefully. It's a lecture I give every year to the interns I work with, focusing on recognizing an animal's rate of respiration with their eyes and not putting themselves in danger getting close to a distressed animal. It's funny, I went to a conference one time and the lecture was given by an emergency specialist, and the lecture was on the topic of watching the respiration rate of an animal without a stethoscope. People are so used to listening, but if they would just learn to watch. Sometimes it's not safe to get close to an animal. It raises their anxiety level. They're under distress. And so if you watch them, I felt so vindicated as a deaf person that the hearing world had finally caught up to me. They'd been wasting so much time all these years.
I use my hands also to feel if the heart has a funny sound, murmur, Oftentimes you can feel that with your fingers if you're experienced enough to touch. So oftentimes I'll be sitting and the client is talking, telling me their life story, and the cat's life story, and that's great. And I'm listening, paying attention, and my hand is on the heart. I can feel a murmur, like, okay, we have to, investigate this more, find out what's wrong. So, and it's funny because when you get into vet school, I remember I'm thinking, oh, they're not going to trust my hands, they're not going to trust me. And they said, oh, no, Kim doesn't feel anything. So, really, being deaf in the hearing veterinary world, the majority of them are hearing. If you got through vet school, if you got through that, struggle of getting through and graduating and becoming successful, it doesn't matter if you're deaf, it's a part of who you are. It can be a challenge at times, but that's how you face it. It matters. If you're, I'm deaf, it's hard, I need support. No, just, okay, now what? Go ahead.
So anyway, people would ask me, do you like being a veterinarian because you love animals, right? And you don't like people, it's just easier to work with animals, right? Is that why you did it? But really, most of my job is I deal with animals for the most part, right? But I'm communicating with clients who are people, and they need to get information from the human owners, so I know how to best deal with the animal and then explain to the human owners what's wrong with the animal. So I'm working through, the owner's emotions and their education level and making sure they understand what the disease process is and what the treatment course will be. And it's challenging because if you don't like working with people, they're half of who's in the office. It's difficult. I have to know how to work with people. It's a very important message for people who think being a vet's just about working with the animals, because we have to work with people. And I've met very interesting people along the way. Very interesting. One woman, I did surgery on her cat. The cat's tail, it had come off because it was hurt. The tail was dead, and so it had to be cut off, amputated. And she's like, my cat's tail is going to be short. And I'm like, well, yeah, right. We talked about that this morning. And she's like, oh, well, okay, all right. The next day, she told me she wanted to keep the tail to make a necklace. All right, or like cute puppies or cute kittens, or some of that's fun for me and whatever, but I'm like, you don't necessarily like working with the little ones and the little puppies and stuff, but I don't mind the little puppies and kittens. But it's challenging again interesting owners, interesting people, and interesting patients.
I think one of my favorite things now is, now that I'm a little bit older and I'm in a routine, is the reaction of people when they come in and I tell them that I'm deaf, and they'll know right away, and they're like, some of the reactions I get are very strange. That's okay. They'll say, oh, okay, I'm a psychologist. And I look at them like, you think this is the psychology of deafness or what? So obviously I can help you. And how they react to the fact that I'm deaf is puzzling. So it's like, all right, I just try to move on. Another reaction was like, she did this. I'm like, I don't know your language. I don't know your language. I don't know what to do. And it's like, that's okay. I know yours. I'll try my language. If you want to try, that's okay. But I know yours, so we'll be okay. So the reaction are things that I don't really expect. There's a lot more resistance. But sometimes I just look at people like, I'm not sure if I should laugh. Are you serious? Or let's just get by that and pretend that didn't happen. I think the reaction is just very interesting sometimes from people.
It depends on how you deal with it, right? Because if you're like, well, I'm deaf and I'm so sorry and I know you didn't expect it, and well, gee, as opposed to, okay, so I'm deaf, so this is how it's going to go. I'm going to deal with your pet. Some clients appreciate just that as long as you communicate clearly and work with them, they accept it. In my community, it's mostly hearing people. Me and my dad might be the only deaf people in the area, maybe a few scattered deaf people here or there, but it's hearing people for the most part who are very accepting of deafness. And so, they're confident in our abilities, and I'm confident in myself, and I think that's what progresses me forward and makes things go well.
I do think it's a little bit different for us because they can choose another vet if they want in the practice, but when they come to the emergency services, they're stuck with me. They don't have another choice, and I do the best that I can. I can't please everyone, but I try the best. But it's like, sorry, too bad if you don't like me. You see intern when they graduate. I mean, what are you going to do? You don't want the intern, so have fun. So yeah, they're really stuck with me. They don't have a choice like with Jenny.
It is fun, though. It's fun to have, a good community who are used to deafness because of Rochester. And, it's no big deal. I'm like, hey, I'm deaf. And they're like, okay, great. Whatever. The frightening part of having someone who's different is just not something we have to deal with here. People are used to it. I mean, once in a while, if I'm really not paying attention, someone will throw something my way and I'm not, I'm not catching it. And, like it's a way to get someone's attention, right? That's always one of our favorite things. People throw stuff at you.
First, I want to thank you for the wonderful evening you've given us. That's been a wonderful time tonight. I can't tell you, people who are here this evening, how fortunate we are to be here in Rochester, to have experience with different deaf professionals in a variety of settings. These two ladies are just two of our deaf professionals who live in the area. We live in a very rare place and are very fortunate for your time, your energy, for your willingness to be with us this evening. Thank you so very much.
Thank you, interpreter.